Welcome to the listeners of TALRadio English, CXO Showtime. We're bringing global CXOs on this platform to share the journey to success. Our guest today is Kara Hay, President and CEO of Penquis, a non-profit organization dedicated to assisting individuals and families to be safe, healthy, connected, and financially secure. Penquis is the largest community action agency in Maine and a licensed mental health agency touching the lives of more than 5,000 people each day. Kara also serves as the president of Penquis subsidiary Rape Response Services, Mainstream Finance, Penquis Development Inc., and Penquis Housing Inc. She is deeply committed to Maine and its communities. Kara is the co-chair of the Bangor Area Community Health Leadership Board, chair of Northern Light Acadia Hospital Board of Trustees, and a member of Community Housing Capital Board of Directors, a member of Schmidt Institute Advisory Board, a member of Community Initiative Advisory Council of Neighborworks America, member of National Neighborworks Association Board of Directors, and a member of the Alliance for Addiction and Mental Health Services. Kara is nationally recognized leader in comprehensive community development, having received 2 awards from Neighborworks America, and is a strong advocate for Maine's low-income population. Kara, welcome to the show.
Thank you so much for having me. It's my pleasure to be here.
As we begin with our listeners and all, we'd first like to know more about how did Penquis came into existing and how did you got associated with it?
Sure, thank you. So Penquis is actually over 50 years old. We were created when President Lyndon B. Johnson created a war on poverty, again in the 60s. And that's when he really said, we need to do more for those who are struggling financially across our country. At that point in time, he established community action agencies for every county in the entire country. And the goal of these organizations is really to be grounded in the communities, listening and learning from those who are struggling financially, and then being able to directly respond to the structures and systems that cause poverty. Penquis was created at that point in time and has simply grown and expanded through the many years to help best serve the communities across many counties in the state of Maine.
I see Penquis is involved with different facets of life and different individuals at different aspects of individuals' life path that one goes through from childhood to old age. How and when you decided you need to address everything, right, from anybody who is requiring assistance from birth to somebody who is old age and needs assistance with terms of assisted living services are required from the age point of view. Can you please bring on some light on it?
Happily. So what we know is that poverty can impact people of all ages. And in Maine, we see our youngest, our newborns, all the way up to our oldest Mainers deeply impacted by poverty, and then all the root causes that feed into poverty. What we realized very early on is that we needed to create a system that really serves all ages, and not just all ages, but really crosses many domains to wrap around a whole person or a whole family, addressing root causes and also providing pathways and bridges to a different future for those faced with the crisis that is poverty. So with that in mind, it's from birth to our oldest Mainers, and it's also looking at a whole person and the many needs that they are faced with on any given day.
Well, day-to-day challenges of every individual at different walks of life are completely different, right? And I believe more often than not, since you work mostly on the low income group people, you may be facing a lot of people who are in trouble day in and day out. As we talk about it, what do you think are the major challenges that Maine is currently facing with the low income group?
Oh goodness, Maine. So let me say, I love Maine. This is where I'm from, and it's such a beautiful state. We have so many great traits and locations to offer. And yet, even in the face of such great beauty, we certainly have significant struggles. A few that I would acknowledge is we are actually the oldest state in the nation, depending on how that's calculated. And so that puts a lot of stress on the workforce. And also, there's an acknowledgement that as our residents age, there are additional supports that are needed, specifically, as you mentioned earlier, around assisted living supports or more in-home supports so folks can age in place where they are in their homes. We also see, because we are a large rural state, a significant transportation barrier for individuals to get to college, to get to employment opportunities, to get to their medical appointments, and even socialize through church and other activities. Transportation is really challenging. Housing is a significant barrier. We have not enough housing for people of all incomes incomes, but certainly because of our mission, we worry significantly about workforce housing, as well as housing that can simply be sustained for individuals who are low income. We also have a significant substance use disorder challenge in Maine. As a mental health organization, we're deeply committed to, again, serving the whole person. So looking at health in particular is very important. And of course, the root cause of poverty and understanding that without appropriate training, education, and then access to assets, the odds of changing the trajectory of an individual and family living in poverty are significantly reduced.
And it's a big team that you have already got over there. I believe about you're spread all across the 16 counties. How do you make it possible to cover every aspect of needs and requirements within the community at Maine, all across the 16 counties?
Of course, and this is a tricky feat. So we have roughly 600 staff on any given day, and as you shared earlier, we serve roughly 5,000 Mainers on any given day. What we recognize and what we talk about a lot is what is the result we're trying to achieve as an organization. And for us, that is really about improving Maine lives, meeting people where they're at, providing them with the resources and the bridge to a brighter future. So we talk about results-based accountability. So we start with that result that together we are trying to achieve. We look at the 4 broad areas of our work, which is around access to transportation, having healthy lives, the creation of housing and assets, and then really supporting the whole family with high quality early childhood supports. From there, everything we do, all 60 to 80 programs, depending on how you count them, fit underneath those 4 categories, all aimed at moving toward those results. And together we align with partners. We sit at every table we can sit at to really push for change and advocate for systemic shifts that will help support people who are living in poverty. And we partner and really work with our community across all sectors, the business community, the faith-based community, our local legislators, government, to say, how can we align to work on these results together? We do that locally, and then we do that through tendrils spread across many counties across the state of Maine.
When it comes to child development, there are a lot of programs that you currently have got at the organization, like early childhood education and all. What are the prerequisites for somebody looking forward to get enrollment into such a program?
So we definitely have a lot of early childhood programs, and we view our early childhood programs across the spectrum. It could be as simple as you have a family who is the first-time parent, and they don't necessarily even have to be living in poverty. They simply might need some parental support and guidance. We provide home visiting for families. So again, it could be any family that has a first child. It could also be a family who has some significant barriers and obstacles. They may be low income. They may have a history of trauma and other such factors that may also qualify them for home visiting. We also have child development centers where we have childcare, Head Start, and early Head Start available for children ages 6 weeks all the way up to 5 years of age. Typically, those are under the SNAP, the Supplemental Nutrition Assistance Program eligibility that those children can attend. We also actually have some private pay opportunities as well. Again, we want families to be served holistically. And so sometimes there are other factors that families are facing where having high quality early care and education is a significant support to those families, even though they might not have a low income situation at the moment. We also have a family visit program. So when children are in custody of the Department of Health and Human Services and are living with a separate care family, they can have safe exchanges and also visiting with their biological families. And then the other extreme end, we also have child abuse and neglect councils where anyone can participate in parenting classes, have resources such as diapers and formula that's provided. And simply it's a connection with our staff around what families are needing in those moments.
When we talk about families, there are a lot of families who require different types of support and assistance. They are going through a lot of turmoil as well. Some of the families, there are several programs that you talk about in terms of the home visiting program and addressing families who are going through substance use treatment and all. We would want our listeners to be more aware of the kind of services that you're offering for families who are under pressure and would want to leverage some of the services you are currently providing.
Absolutely. And it is one of the tricks. It's a little that's complicated a piece about Penquis is we are so large and we have so many services. Sometimes it's simply hard to get your hands all the way around all of it. With that in mind, what we have a team that we've developed so that if any individual comes and has a need, that they can be connected with a person to say, tell us about your situation. What is it when you think about the major categories of your life? Where do you feel like you have great strengths? And then where are the areas you really want to work on together with us? So for instance, if someone came to us with a substance use disorder, we would quickly say, is this an area that you would like to work on? If they say yes, we can connect them with our own internal resources and then also have warm handoffs with partners if there are services they need that we don't provide. We do have behavioral health supports and counseling. We also have a residence, which is called the Macaulay House, which is for women who have a substance use disorder and are also either pregnant or parenting young children. They can actually live there. They have 24/7 supports. They also have a mentor, if you will, a staff person of Penquis who will help model high quality parenting and early care and education. And again, we're working with these young women to basically gain stability, to move forward into their own housing, to get workforce and training, and to eventually have jobs. So that would be one resource we have. But one of the strengths is that we have a team of staff who will meet a person where they are and really say, determine together. Because again, we can't say to a client, to someone coming to us, this is what you need. What we need is to hear what they want to work on and then meet them where they are and help align them with the resources.
Right, and these families are tremendously always under pressure, right? I mean, one of the pressure that we have seen with low-income families is the financial assistance that they would require. Are there any programs where you have financial assistance programs for these families? Would you want to talk about a little bit on it?
Certainly, and there are a number of them actually. And I would just say to your point, low-income families are under tremendous pressure. And if you think about the added impact of the pandemic and now inflation, where gas and food and heat, diapers, everything is going up in cost, we hear a great amount of concern from our communities, appropriately so. And honestly, people of all incomes have concern. But if you're really under pressure, just the slightest amount of inflation can really impact your life. So we have many programs. And then we do still have deep worry about when the funding runs out, what will happen for the families we serve. We have heating assistance that definitely helps to get folks through the winter. We also administer emergency rental assistance, which can cover over a year of rent for those who need support. We have utility assistance. We also offer transportation at no cost for people that have Medicaid. We have a match savings program where for every dollar you save, you get a $4 match up to a few $1,000s that could be used to purchase a car, to purchase a home, for home repair, and to go to college. So those are all really wonderful supports. We also have weatherization supports and central heating improvement programs in case a furnace happens to go down. All of these are direct benefits to those we serve.
As we all know that a healthy society is good for everybody, and we would want everybody in our society to be very healthy. I do see that Penquis provides a healthcare navigator programs. Can you give a little bit more inputs on that program?
I would be happy to. I love all of our programs, but this is, to your point, one of a very impactful list of programs. And so what this is we have a lot of individuals who don't qualify for Medicaid. They're this close. They're just right outside the boundary and they don't qualify. And navigating healthcare is complicated. For anyone that's done it, I can almost see your faces. Like it's hard to figure out healthcare if you don't have your employer doing that, if you don't have a set employer that either offers it or that walks you through that. So we had a lot of individuals historically that were in deep, deep trouble and debt because of lack of access to healthcare and insurance in particular. So we have a navigator who works one-on-one, and the stories we hear, honestly, there are lots of deep tears and incredible appreciation, because obviously having insurance, if you have monthly medication that costs $500, $1,000, $2,000, whether or not you're struggling financially, that's a significant burden. So if you're faced with poverty and you have very expensive medication or healthcare appointments without insurance, you can get buried in that debt. So this specific navigator works with anyone who has a need and literally sits down together and goes through the marketplace to sign up for insurance. And the person actually looks very closely and has a discussion around what that person's needs are are, because of course what you sign up for depends on what you really need as an individual.
Another problem that we have also seen in our society is the assault, the sexual assault. And there is a significant of work that Penquis is doing in terms of trying to provide rape response services. And there's a lot of education that is going around in terms of making our society a lot better to what it is right now and keep improving on it. How and what are the challenges with Penquis team in terms of addressing these incidents, and how do you basically cope up with these challenges?
So sexual assault is also a crisis in our country and a crisis in this world. We are thankful to be able to engage in that work every day. And honestly, even during the pandemic, our rape response services team never stopped providing support. So there are a few prongs. We know that prevention efforts to really help talk about what healthy relationships are and what the root causes of sexual assault are, and also what to do in the situation if you've experienced sexual assault or you know someone else has. What are the resources available to you? Having those conversations out in the community are critically important. We have staff that go to many of our local schools and have these conversations in middle schools and high schools, even in elementary schools, backing it up from the perspective of what is a healthy relationship, and starting there, really embedding ourselves in schools to start that prevention work matters. We also have a great relationship with some of our local universities, and we work with fraternities and sororities who help, one, fundraise, which is great to really support and address sexual assault services and supports, and also to educate. We do a lot with local races and pride marches, and again, just having tables at events to talk about what sexual health is and what sexual assault is, and really being there as a trusted resource. We also have a sexual assault hotline so people can call anonymously and gain supports. We accompany individuals who have experienced sexual assault in court. We even go to hospitals for individuals who have experienced sexual assault and are getting help. So all of those are really important supports. The other thing we know is there's never enough funding to address sexual assault, and we've not come close to really addressing the root causes. With that being said, we're always advocating for additional funding. We're always approaching donors to ask for help because this is a wildly underfunded and critically important service. In the last few years, we've also started doing more with sex trafficking and trying to really work with community partners to address sex trafficking. And also probably about 6 years ago now, we created a children's advocacy center, which in a really awful way is a service that should not need to exist, but it's critical that it does because of children in our community experiencing sexual assault. So this is a location where children and families who have experienced sexual assault can come and be interviewed safely with Penquis staff and our local Department of Health and Human Services and our local law enforcement, one time in a safe way, so that that family and those children can have access to resources, and also so the child does not have to repeat the trauma over and over again by telling their story. When they come in, they come in as a victim, and when they leave as a survivor, and they feel like they are a part of something that helps them to move forward. So again, these services are critically important. These services are open to anyone. They're not income-based because we know anyone can experience sexual assault, much like anyone can experience a mental health diagnosis. So we want to be here and be supportive.
Penquis is building a team which can actually address this major issue. And you have several programs like SART programs, START trainings, RRS volunteer advocate trainings. Even if give some more information about these programs. If anybody is interested to get associated with you to be a part of these programs and help in the causes that you're trying to make the society better, how can one be involved with it?
Yeah, thank you for asking that question. Much of the work that we do requires volunteers. Again, there's not a lot of funding to support staff, so we always want volunteers. And also, this is a community-wide issue. It's a country-wide issue. So we are always looking for volunteers. We get volunteers who participate on our hotline. Sometimes volunteers participate in events, whatever they're comfortable with. We have great training and supports, and we rely on our volunteers heavily. Some simply work on fundraising, which is wonderful. We're always looking for volunteers. If you are interested, I'll actually give you my direct email address. We would love to hear from you. My email address is KHAY@Penquis, which is PENQUIS penquis.org, and we would love to have you volunteer. You can also reach out to us through Facebook, our Penquis Facebook page. That's a great way to reach out and learn more. The question about the START team, this is really about addressing sex trafficking, and we work very closely with our local hospitals, in particular St. Joseph's Healthcare, where we have a nurse who recently received an award actually for her great advocacy and leadership in this space. And this is about having a lead in a hospital who works with our staff when someone comes in who's faced either sexual assault or sex trafficking.
You mentioned about a child advocacy center earlier on. And what it's all about, and who refers to CAC, and what happens at the CAC?
So the Children's Advocacy Center, again, this is for any child who's experienced sexual assault and needs a place to safely be interviewed and share their story so that appropriate action can happen against the perpetrator, if that's appropriate, which it typically is, as well as to identify what supports are needed for the child or children. I will say, previous to having the Children's Advocacy Center in place, what would often happen is a child would go to school, and a school, for instance, would be a place where a child might share that they've experienced sexual assault. The child might share it with their teacher, and then of course the teacher might then go to the principal or to the guidance counselor. The child might then share it with the guidance counselor, who might then share it with the principal. Law enforcement might get brought in, they might share it there, then they might need to then share it with the local Department of Health and Human Services. And so the child was sharing the story multiple times in a way that those that were interviewing them might not necessarily have the training and the skills to engage that child in the best way possible in a truly forensic interview, as well as the environment from a confidentiality perspective, and also just a place that's safe and feels soothing to have a really hard conversation about trauma might not be in place. Our Children's Advocacy Center, again, is a place for families. They can come confidentially. There's a back door they go in so that they don't have to feel like anyone sees them there. It's a very safe and warm space. The interview happens with a team of people who are trained and skilled, and it's recorded so the child can share it one time and not have to continue to relive the specific storytelling experience. From there, our staff work really closely with the family to make sure the child and any other children in the home are safe moving forward, that the law enforcement is aware of the perpetrator and next steps are happening. And then again, that the resources are provided to the family and child. One of the pieces that's deeply touching to me is as a child prepares to leave the Children's Advocacy Center, they actually trace their hand. There's a handprint for every child that has been there. And then the child has the opportunity to color or decorate the handprint. And again, some of these children are quite young, and they decorate their hands, and the hands go up on the wall. And so when you walk into the Children's Advocacy Center, it's a powerful image. There are handprints all along the walls, which on one hand is powerful because it's deeply upsetting that children experience sexual assault. It's also powerful in the perspective of the number of children who leave with resources and supports because of the work of the Children's Advocacy Center and of Penquis.
And you have several MDT partners. Who are these partners, and how are they empowering your initiatives?
Yeah, so we are even partners in this work, and that matters greatly. Penquis is happy and thankful to be the ones providing the space and having staff dedicated to this work. But we know that this is not just Penquis's work. As I mentioned earlier, we have to do our work in alignment with key partners, and this is one of those programs that requires key partners. We have our law enforcement, both our sheriff's office when needed, as well as our local police force, our Department of Health and Human Services, and sometimes we have school systems that are involved, or perhaps other mental health partners, local hospital systems, depending on where the referrals come from. This is about providing, again, a safe space and about being a truly equal partner in this work.
Right. And Maine goes through a lot of environmental concerns as well. It requires a specific and a special attention in terms of energy assistance. There is a lot that you're also doing. You mentioned about the HEAT program a while back. Any eligibility guidelines that you would want to provide for our listeners in terms of anybody looking for some assistance?
Absolutely. So if you live in Maine, you know that though it's beautiful, we have a long, cold winter. And with heating prices, especially now, it's really hard sometimes to make it through. So we do have the HEAP, which is the Home Energy Assistance Program, and the eligibility typically aligns around the poverty guidelines. And you can absolutely go on our website and learn more, or reach out to our Facebook page, and we can give you those specific, depending on the number of members in your family. You can learn whether or not you're eligible. That being said, we have a lot of Mainers, and again, of all ages. We serve our oldest Mainers to families with some of our youngest. Anyone can struggle to stay warm during the winter, especially considering the length of our winter. That being said, we work really hard with a lot of partners to raise additional funds to support those who don't qualify. We call one of the funds the Good Neighbor Fund. And if you go to our Penquis website, penquis.org, you can actually donate to the Good Neighbor, which is about helping people who don't qualify for heating assistance. And literally, we have people that might not qualify by just a few dollars. And then we're able to help fill oil tanks in that way.
Right. And then it must have been very challenging due to COVID. All the existing processes were off, and you need to resort to new methodologies and mechanisms. How challenging was it, and how did you overcome, and what changes did you bring into help people who are in need during these terrible pandemic times?
Such a great question. So, of course, no one predicted the pandemic would come when it did or how it did. And I will tell you, I'll never forget, it was early March of 2020 where we're seeing the spike across the world, and we're realizing that things were going to need to change. We have 600 staff, and almost all of them deliver face-to-face services every single day. So we had to move very quickly and bring our core leadership team together to think about how to do the work differently, while also recognizing that some of the work is about keeping people safe, healthy, connected, alive, so that some of the services needed to stay the way they were, but we needed both our staff and those we serve to stay safe. I'll start with those services that really required continuation of face-to-face. All of our housing locations, our assisted living programs, our Charlotte White support services, which includes our residences for individuals with mental health diagnoses, intellectual disabilities, and acquired brain injuries. All of those needed to happen face-to-face. Other programs are transportation. We have individuals who are on dialysis or have cancer treatment or have critical medical appointments. They had to get there, and we were the only mechanism for them to be able to do so. So we very quickly worked with our public health officials to learn how best to continue to offer these services safely. And we followed all of the not just the mandates, but the recommendations of those who knew far better than we did about public health. So we were able to keep all those services in place. In addition, we quickly pivoted a lot of staff to working from home remotely, and we were really thankful to have such a great IS, information systems team, who really were able to get what we needed for equipment and pivot people to work from home so that we did not stop providing services. This meant that a lot of our programs, when they were determined that they could happen virtually versus face-to-face, that they were quickly transitioned, and we were able to do phone applications, to do virtual check-ins, to have counseling through computers. Many services transitioned remotely. And so literally we didn't skip a beat. The services continued to be provided. Through time, we assessed in an ongoing way which services are simply done more effectively face-to-face. I failed to mention rape response services, but certainly sexual assault services, those were too sensitive to happen strictly via phone or computer, so those stayed face-to-face. We also quickly transitioned back our counseling services for children or people with a lot of trauma in their background, recognizing that face-to-face was critical. Again, our child care and early childhood locations also pivoted back fairly quickly because, again, if families are going to work, their children need to be in care. So doing that support and service virtually was not allowing families to work.
As we talk about concerns within families, we do see a lot of other issues such as divorce. There are a lot of parental rights, responsibility issues that come up, abuse, protection from abuse. And these will also require a lot of legal assistance. Are there any programs where you are helping families who are under such a turmoil and trying to get them out of such situations and providing them right guidance?
There absolutely is. We actually have a program called the Penquis Law Project, and it specifically was formulated to address exactly what you were describing, to individuals facing domestic violence, to those needing simply support due to the situation they're in. Could be around separation or child abuse or anything pertaining to family dynamics and splits. This was a really amazing program. It has done incredible good. Again, some of the stories that touch my heart the most deeply are connected to the Law Project. One of our challenges with Complete Candor is around funding the Law Project. We've had this program in place for decades. It's critically needed. We would love to expand it, but identifying funding that supports the Law Project in an ongoing way is difficult. So right now, for instance, it would take a little while for us to be able to serve additional individuals simply because of a lack of funding to hire on more attorneys.
To build a best society as we progress, as we nurture individuals, you have programs with childcare. Do you have any programs for youth engagement? How are you nurturing youth towards the right direction? How are you empowering them to become a very, very innovative, assistive, as well as responsible citizens of the society?
Yeah, such a great question. Our youth are our future, right? They're our hope and our future. So how are we educating? How are we preventing anyone from taking the wrong path, specifically our youth? And also, our youth just came through a pandemic. So the impact of that on all of us, but in particular, you have to worry a little bit about our youth and how they have fared and any implications because of the pandemic on their mental health and on their trajectory in general. We have a number of programs aimed at supporting youth. Of course, we have our early childhood programs, which I spoke to, but also our middle school to high school students certainly need supports. I'll speak to a few. We have a number. As I mentioned earlier, we have prevention services in our schools around sexual health and healthy relationships. We also have created a new program that talks about both how to be smart with money and financing, as well as how to make wise choices in relationships and socially, emotionally. That's a new program that we've started this year in partnership with two other community action organizations. And the reviews and feedback we've gotten from the schools where we are embedded has been phenomenal. And not just the teachers, but the students have said how much they really appreciated it. And it feels like a very safe environment for them to have open conversations about things that are hard. Being a youth today is difficult. There's a lot thrown at you. So this is a safe place to talk about decision making and relationships, as well as looking to the future and what does being smart with money mean, and how do you plan, and what does savings entail. So that's been a really great program. We also know, specifically in some of our rural communities, but across our state, that many of our youth are bouncing from house to house, couch surfing, if you will, homeless in that way, or they're in families who are homeless. So we've established what we're calling a host homes program, and this in Piscataquis County. And this is for youth who, teens who need a place to be. They need a place to stay. They don't have a home. They're homeless. And what we've established are people, just regular people in the community who are willing to basically provide a space for those youth to stay for a period of time so they can continue with their natural supports in their school system, with their friends, instead of being transitioned to a bigger city or urban hub where they don't have those natural supports.
And when it comes to educating youth against substance abuse, how are you basically trying to bring them up in terms of understanding the difficult situations that they're going through, empowering them to overcome the challenges that they are facing? What kind of assisted programs do you have for youths who are reeling with the opioid crisis at the moment?
Thank you for asking that question. As I mentioned earlier, a lot of Mainers have been impacted by substance use disorders, whether it's opiate use disorder or alcohol use disorder. It's been rampant in Maine, and many have been impacted. A few years ago, Penquis was one of just a few organizations across the country who received a federal grant for child victims of opiate use disorder, which actually really means any youth who has experienced and has had a challenge basically because of opiate use disorder in their lives. It could be a caregiver or a parent. And with those dollars, and we continue to have them, we've been able to work out in the community with any youth who's been impacted by opiate use disorder or substance use disorder. So we have had summer groups that meet and talk about their experiences in self-esteem building and really trying to work in that way. We've also gone into schools, and our team is just amazing to educate, again, as we do with healthy relationships, to educate around some of the more behavior choices around substance use, and also talk more specifically about substance use disorders. I actually had recently a retired licensed alcohol and drug counselor who's much respected in the state of Maine reach out to say, yes, this program is wonderful. The staff are amazing. The language, the materials they're using are just right. Thank you. In addition, this group of staff have also been working with local law enforcement to create a comfort kit so that if a police officer happens to go to a home where there's been substance use disorder and there's some sort of an incident, that if there is a youth there, that they're able to engage with them with this comfort kit that one, provides them with resources, but also some actual hands-on materials that might help them to be soothed through the situation. So we're really thankful for that. And a number of our local law enforcement have engaged in that and have been very appreciative.
Yeah, those are very serious issues to be handled very carefully, and we need the right people to be taking care of it. Thanks for taking care of such a very delicate issues in this society. And one other important thing that Penquis is involved with is assisted living services. How are they being offered? If anybody wants to go ahead and approach you for assisted living services, what are the prerequisites? What is the criteria? Is it coming at a cost? And if yes, how does it progress?
Sure. So we have a variety of housing options. We have housing that's actually created for individuals who are low income and either are over the age of 55 or are families. We have over 300 units of housing in that space. We also serve roughly 90 individuals through assisted living in 3 locations: Bangor, Camden, and Millinocket. This assisted living model is that there is an actual housing component, which there's a proportion of someone's income they pay based on how much they make for the housing. The assisted living component of that they're paired together is about establishing the level of daily support an individual needs. And typically that's actually determined through a state assessment, a medical state assessment that decides what level of support you need. It might be assisted living. If you have significant needs, it might be at the higher level of nursing home care. So when the state goes to that assessment, if you're determined that you need assisted living level of care, you would come into one of our facilities, and then you would have 2 meals a day prepared for you. You have your own kitchen, but recognizing that people that need this level of care often have medical diagnoses or a disability of some sort that requires more support needed. Often there's help with medication and then daily living supports. It could be from bathing to dressing to other supports, transportation to doctor's offices. I love this program. We need so many more of them. 90 is a drop in the bucket. And so we're actually advocating to expand assisted living. Again, our Mainers are aging, and we know that typically people do not go from living in their home straight to a nursing home. There needs to be an interim step, and we have found that assisted living is one that the residents really love, and it's appropriate level of care for individuals at that point in their life.
And all of this is not possible with a set of volunteers at your end. And there are a lot of people who are open for being associated with such programs. And I know you have a lot of different levels of volunteers, right? If somebody wants to get associated, what are the different levels of volunteers that are available for anyone to get associated with Penquis?
Yeah, absolutely. So we love volunteers. We rely on our volunteers, and honestly, any level of engagement we would appreciate. It can go from helping with rape response services in transportation. We actually have volunteers who volunteer to drive. They simply get a small stipend to help cover their mileage costs, but they literally bring clients to and from appointments to help get the work done. We have people that would rather do a softer volunteer, and they might decide to donate meat, a turkey for Thanksgiving, gifts for the holidays for our Christmases for Kids program, backpacks for the We've Got Your Back to make sure students are ready for school in the fall, or even donating coats or gathering coats for our coat program because, again, Maine winters are long and we see a lot of folks who show up without coats when it's 20 below zero. So there are so many ways to volunteer and to give. We also have a foster grandparent program, which are for our older Mainers, and they often can volunteer in school systems through Penquis in most of the counties in Maine, or in any of our child development centers. And typically they're called Grammies and Grampies, which is just delightful. We also have volunteers who want to come in and help file documents, or simply want to learn how to do writing more. We have interns who come and help in the work. Any of those ways are great. We have seen since the start of a pandemic, and we appreciate it so much, that during the community campaigns that I just mentioned, the turkey drive, Christmases for Kids, We've Got Your Back, and our coat program, a number of community members have decided to take a lead on working within their own circles to get more donations. They volunteered their time to help raise more money for those campaigns. Phenomenally, phenomenally helpful. If you're interested in volunteering, again, you are welcome to email me. I can get you in touch with the right program depending on what your interests are. Again, my email address is khay@penquis, penquis.org, or you can go to our Penquis Facebook page and message us, and we're happy to get you in touch with the right staff.
Kara, if you would like to share any most remembering events from your services that you're providing, what would that be?
Oh, goodness, that's a tricky one. I think I would probably say a few things. One, the ability and willingness of our team to pivot and work so incredibly hard during the pandemic to make sure our community has been and continues to be supported in the face of great uncertainty and fear, and to just see our 600 staff not ever stop, always putting our community first, especially early on in the pandemic. It was a really scary time, and our staff simply rallied and put people first that need them. That was amazing and truly inspirational to watch how our team continue to stay in the work. A few years ago, we brought two organizations together. The Charlotte White Center became a part of Penquis, which is now called Charlotte White Support Services, that brought mental health services and supports into our organization. Since I started in my role, it's been something I felt really strongly about, addressing root causes of poverty without also acknowledging and supporting mental health, and how that ties into all of it, for me, seemed like an incredible whole. So allowing Penquis and Charlotte White to come together to provide more of a no wrong door access for our community and our clients was critically important. And also a heavy lift, bringing two organizations together that have both had over 40 years of history. That's really a big task. And having the two organizations and all the staff become one to better support the community has been deeply, deeply impactful.
Absolutely. And I would not want to miss out on one key programs that you have is for people with disabilities. Any inputs that you want to provide for our listeners on that?
Absolutely. So we do have a number of actual homes, residences where individuals with developmental disabilities, acquired brain injuries, or mental health diagnoses can live and have 24/7, 365 days a year supports. These are spread out across our Bangor Brewer area as well as in rural Piscataquis County. These are beautiful services. And I mean, again, these are homes where people with disabilities live. Beautiful, beautiful programs. We also have Special Olympics, so that those we serve who want to compete. Our athletes compete in multiple events across the year and have parades. And I will tell you, if you want to participate in something that lifts your heart, Special Olympics is that thing. It is so beautiful to watch and cheer for our athletes, and they work so hard. That's spectacular. We also have day programming, so that if individuals who don't necessarily need a place to live but have disabilities, they simply need a way to structure their lives to be out doing things and engage, much like many of us have work. They actually will go to a location or go out and venture in different locations across the week. So for instance, perhaps they go to a local farm on Monday and pick vegetables and learn about the planting season and farming. Perhaps the next day they go to the library and pick out some books that they are able to bring home. And this is about providing structure and supports that are based on the individual interests of those clients with developmental disabilities, which is a beautiful service as well.
What would be the most notable accomplishment that you feel that you are very proud about?
I think I would say, again, I would reiterate the piece around the staff and how they've come together and stayed strong for our communities. I would also say that in my tenure in the last 8 years as CEO and president of Penquis, we've grown a great deal. And that's not just growing for the sake of growth. It's growing to bring in programs and supports that better support and embrace those we serve. So we've over tripled in 8 years in size. The programs, again, have expanded. It's more about being entirely comprehensive and engaging in a way that will help lift and move people. I'm deeply, deeply thankful and proud of that work because it is about really changing lives. And we feel that to do that, better aligning with partners and having a more expansive array of services is the best way to move and lift communities.
That's a very wonderful statement from you, Kara. And I believe Penguins should become more stronger and stronger to address not just 5,000 people each day, but many more. But I believe you'll agree with me that it should become a society where the society should be happy and all the people in the world should be much more happier, and that number should come down on a daily basis, right? And we'll all appreciate like all the families growing healthier, all the families becoming more richer, all the families becoming more happier. What more do we want for a better society? And I believe the footsteps that you're taking and the work that you're doing with your team, Penquis, Kara, it's really wonderful. It was a pleasure having you on the show, and thank you for being with us.
Thank you so much. I agree with you wholeheartedly and everything you just said. I appreciate your time. Thank you to all the listeners, and I hope you have a wonderful day.
Thank you very much. You take care. Bye-bye.
Thank you. Take care.